Hello and welcome to today's episode on Life Saving Aid. Today we are going to be looking at nose bleeding, also known as epistaxis, and what you can do in order to help stop the bleeding. Nose bleeding most times can be harmless. However, when you begin to have associated dizziness, headache, blurring of vision, the feeling of fainting, please don't sit at home trying to carry out this procedure. Make your way to the hospital. It's important that we know that during the summer season, nose bleeding is quite common. Therefore, this information is going to be very helpful. For someone who is having epistaxis or nose bleeding, the first thing you do is to sit upright. Next, you lean your head forward like this. So this is an upright position. You lean your head forward. This prevents the swallowing of the blood that is coming down through the nose, because at times some will enter the back of the mouth, which is the throat, and it can be swallowed. So in order to prevent that from happening, you tilt your head forward. When you've done that, with 2 fingers, pinch the soft part of the nose. With 2 fingers, this is the soft part of the nose. So here, okay, with 2 fingers, you pinch the soft part of the nose like this. Okay, when you do that in an upright direction, so you're leaning your head forward, but in an upright position like this. And then with 2 fingers, you pinch the soft part of the nose and open your mouth, because with this procedure, you have to use the mouth to breathe, because you'll be doing this for 10 to 15 minutes. So you stay in this position for 10 to 15 minutes, after which you release the nose. Most times the nose bleeding will stop. However, if it does not stop, you can repeat it again for another 10 to 15 minutes. Another method that can be used is to get a clean cloth and ice. Please do not place ice directly on the nose. You get a clean cloth and you pour ice into it. Okay? When you do that, you wrap it very well, and you place the wrapped ice on the bridge of the nose like this. Okay, and you keep it in position for 10 to 15 minutes. Most times when you perform either the pinching of the soft part of the nose for 10 to 15 minutes, or using ice block wrapped in a clean cloth and placed over the bridge of the nose for 10 to 15 minutes, the nose bleeding is expected to stop. However, if it doesn't stop, please make your way to the hospital. I hope this video helps someone out there. Share this video so that together we can help save more lives.